Good morning, everyone. It's Madeline with Together SC. Thank you for joining us. This is a really exciting opportunity, and we are thrilled to be bringing to you today the team from HopeHealth over in Florence, who have invited us to partner with them on their efforts to engage new partners in the work they do in a four-county area that they've served. HopeHealth has been around for how long, Tiffany? I should know that, but I don't. I think you're muted.
This is our 30th anniversary. Actually, last weekend, November 6th, was our actual 30th anniversary.
Wow. Good for you. And you started as an HIV/AIDS clinic and then converted to a primary care facility and all that. And I'm sure you're going to give us the history, so I'm getting ahead of myself. Before Tiffany gives us the intro, I just want to once again ask you to share in the chat box who your name, organization, where you're located. We've got the mics muted. We'll have questions at the end. We did schedule this for 2 hours, but we may not need that much time. But if anyone wants to stay on at the end for additional questions, we can do that. Our objective today is to introduce to you the opportunity to partner with HopeHealth in the work they do, in the work you do. And Cecilia is with us. She has been a partner. Her organization, Lighthouse Ministries, has partnered with HopeHealth for how many years now, Cecilia? Oh, you're muted too. Okay, she's gonna catch us up later, but she's gonna talk to you about what it's been like to work with HopeHealth. And so if you are in the service area of Southern Florence County, Williamsburg, Orangeburg, and Clarendon County, or if you serve those areas from another location, helping your clients meet the social determinants of health areas of need, this is where you need to be this morning. So thank you for that. I think that's all. Oh, I will come back on at the end and talk to you a little bit more about next steps. But Tiffany, will you introduce your team and the organization and what we hope to accomplish?
I will. Can you all hear me?
Sound good.
Good. I love it when technology works. Thank you all so much. My name is Tiffany Strauss. I'm the Director of Community Relations for HopeHealth, and I have had the pleasure of serving this amazing organization for just over 9 years now. And so much is happening with us, as I'm sure is happening with all of you all. So we really are so excited to have these to begin this initiative with Together SC and with all of you, and look forward to all of the new friendships that we're going to make through this initiative. Our goals for this, as Madeline said, and you'll continue to hear us talk about, are to build new friendships and new relationships that can result in meaningful partnerships so that we can continue to serve the people that live in the areas that we all serve. And so we are really excited to learn of all the ways that we can help you all do that. Just as a reminder, our service area for our FQHC, which stands for Federally Qualified Health Center, Sally will sort of talk with you about that in just a moment. Our service area is Florence, Clarendon, Orangeburg, and Williamsburg counties. And so those are the areas that we are really looking to do some great work in, or continue to. I want to thank you all in advance for your grace and your patience this morning. This is the first time we've done something like this. And so we're going to get through this, and I'm sure we're going to learn all kinds of ways of how we want to do it differently next time. So thank you for your patience and your willingness to help us get through this first one and figure out how we can continue this initiative and improve it and build it along the way. So what I'm most excited to do this morning is introduce you to these amazing ladies on my right. Sally Bachman is our Chief of Staff. She's been with HopeHealth for
13 years.
12 or going on 13 years. And Dr. Farah Hughes, our Director of Behavioral Health Services, and she's been with us several years as well. And so they're going to share with you what partnerships mean to them and their parts of the organization, and to really just help get your mind going. Dr. Hughes especially, she serves a very large portion of our patient services here at HopeHealth, but there are others as well. And so along the way, as we continue to get to know one another, you'll hear from other department directors like Dr. Hughes and how those areas we can work together and those other parts of the organization to make great things happen in our service area. So I am launching the plane and landing it. And so I am going to introduce and turn it over to Sally Bachman, our Chief of Staff, so that she can tell us all the wonderful things about where we're going and where we've been.
Thank you, Tiffany. And Madeline, you did such a nice job in giving an overall view of why we're here and why we've asked for this time and why we're beginning this work together. And I so appreciate that. Tiffany mentioned taking the plane off and landing the plane. And I would have to say that my favorite part of flying is that takeoff. And it's usually very fast and, you're, excuse me, pressed back against the seat. So I'm going to hopefully go quickly, but press us back and engage us in what we're hoping to do and why this is so important to us. Like Madeline mentioned, in 1991, we were founded as a volunteer agency that provided support and care to people living with HIV and AIDS. In 2007, we acquired an FQHC status, which means that we were then a federally qualified healthcare center. It opened the door to us being able to provide primary and preventive healthcare to anybody who needed us, primarily at that time in the Florence County. We've expanded into other counties, as has been mentioned. And in 2013, we acquired Black River Healthcare Services, and they were serving the Williamsburg and Clarendon counties. So we did this overnight expansion of patient base and staff and the opportunity to provide primary care in that service area. In 2019, our Orangeburg office achieved a community health center or FQHC status. So they moved from an agency that provides support and treatment for people living with HIV to now being able to also provide primary care and preventive services. So kind of like a really quick overview of a timeline from 1991, when we only served in a supportive capacity people living with HIV, to now 4-county area serving over 50,000 patients, a workforce of 600 plus employees, and we do primary care and so many other services. Because we are relatively new in the Clarendon and Williamsburg and Orangeburg area as primary care providers, we wanted to make sure that you knew what we do, the range of services, and what our teams look like. So we provide primary care in Williamsburg and Clarendon County to pediatrics, adult care, the whole family health gamut. We offer behavioral health services, substance use disorder treatment, access to nutritional care, women's health, endocrinology, and we're always looking at ways to better serve our patients. We provide dental care in Kingstree and Manning, not in Orangeburg yet, but we really want to make sure that when that person walks through the door, that we are able to address whatever their primary concern is, whatever their healthcare needs are. And if we can't do it, we want to make sure that we know who in the community can. And so that's where our partners come in a really critical way. We know that serving in a rural area, that there are some very unique needs that present themselves. While we want to meet every need, it's really not in our expertise to do that, nor in we don't have the time, we don't have the capacity. And so we have to be able to turn to other people to do that. We are able to, when a patient comes in and to see their primary care provider, whether that's in the peds area, whether that's a dental service that we're providing, or in adult health, or even a veteran walking through our door, that person has the opportunity to see their primary care provider, an opportunity to see a behavioral health consultant or a counselor, meet with a nutritionist, meet with a care navigator, a case manager. We try to wrap around that patient And then we want to be able to also help them see that in the community that there are partners, that there are other agencies and services available to help wrap around them too. And that's why we're here in this conversation. So I might have missed something. Yeah, so some of the primary needs that when talking with some of our leadership in Orangeburg, Clarendon, and Williamsburg is access to transportation, access to the internet, and also supportive services that come really from a background of how do I do this? So emotional and mental support, and also that dealing with senses of isolation. So I would just ask if you're aware of services that might not be on the call right now, or if you yourself know what we can do to meet some of those needs that I just mentioned. Those are priority needs that we have within those counties. So I just kind of wanted to put that on the table. And I'm going to turn it over to Farah, who's going to take the plane more on the exactly autopilot, and she's going to provide a little more information about what we do from the behavioral health department.
Sure, thank you very much. And like Tiffany said earlier, we were trying to get out our nervous jitters. And sometimes when I get nervous, I just talk and talk and talk and talk. So you guys will have to slow me down. And if I don't cover something that you want me to, there is the time, Madeline said, at the end for questions. So I'll do my best to give you an overview of behavioral health here. And it's not going to be, what I hope you see is that behavioral health doesn't mean we're just looking at behavioral health, but because we believe in integration and wrapping around our patients, behavioral health touches so many other areas of the services that we provide here. We try to integrate and connect. We don't want to just be like siloed, fragmented services, which patients often experience, and they leave one provider or one agency, and then they're kind of lost trying to get to the next provider or agency or service, and there's no one there to help bridge. So that's why this is so great. So thank you for this opportunity very much. First, I want to give you an overview of the behavioral health services here at HopeHealth. I have been here going on 5 years, 4.5, 5 years. When I got here, we had, HopeHealth was already integrating behavioral health services. We had about 6 behavioral health providers, I think, who were not prescribing, so not including the psychiatrists that we had. And they were in 3 or 4 of our offices. Right now we have 15 sites. Is that still correct? We're growing so fast. So 15 going on 16 sites, 17 maybe. And we are just growing and expanding, and that's exciting and exhausting. And that's why we have to connect with you all. So our aim is to have a licensed behavioral health provider in every single office. And for the really tiny offices, we have a couple of those. We may not have somebody on site all the time, but we have really strengthened our telehealth presence and our ability for someone like me to jump in to a patient who may be sitting in a Greeleyville exam room, So it's kind of like we're together. So we're trying to bridge those gaps that way. And that's probably my favorite part, my favorite program of all the behavioral health services that we have is our primary care behavioral health. So like I said, every behavioral health clinician that we have, they are licensed, LMSW or LISW, or clinical psychologist or counselor. We also have licensed addiction counselors and certified addiction counselors. And in primary care behavioral health, what that looks like is a behavioral health consultant, we call them BHCs. They work side by side with the medical providers, and they're bumping into each other in the central, nursing area. They talk about patients, they see the needs that patients have, and the medical provider has the option to pull that consultant into the exam room to help that patient. That patient may have a lot of psychosocial needs or distress, crisis going on in their lives. And especially around here, we don't live in California or New York. So people don't think, oh, I need to go get a shrink. They go to their doctor, and often our doctors think, oh, I need help handling these issues. So we have the staff right there to be able to jump in The patient doesn't have to tell anybody, oh, I went to see a mental health provider. They can just say, oh, I went to see my primary care provider, and get what they need. So that's primary care behavioral health. It's one of my favorite things. And we are in, so primary care, obviously, but also our infectious diseases clinics and our pain center here in Florence also have behavioral health consultants who work in those medical teams. So that's one of our programs that we offer in behavioral health. The specialty areas that we have include psychiatry. And right now they're all located in Florence, but we are looking at traveling to certain sites a half a day or a day a month. We are also making use of our telehealth technology, which increases access significantly for patients living in these outlying areas. I saw a statistic the other day that about 55% of counties in the United States do not have even one psychiatrist. Yeah, so we are working hard to make sure that we can get into places where people need that kind of help. We also have specialty level mental health counseling and psychology. That's where I see patients. So think about just your traditional outpatient practice. These are people who maybe need more intensive services than can be provided in primary care, or longer term kinds of therapy for trauma or exposure therapy or things like that, or psychological evaluation. So there is that arm that our BHCs can refer into if they need to. And then our final area is our substance use disorder treatment. We have it on the ground in King Street and Manning and here in Florence. And again, we also are offering telehealth connections to other sites too. If a patient is enrolled in our substance use program, they also have to receive care navigation, which is like case management, and counseling. So if a patient is receiving medication-assisted treatment, for example, for alcohol use disorder or opioid use disorder, they can't just come in and get meds and leave. We have to make sure that we are wrapping around that patient, because we know that's what leads to long-lasting recovery and helps prevent relapse. So we have an excellent team in substance use. And so those are the areas of behavioral health that we have. And even those that are not integrated into primary care, we are working hard to collaborate and communicate with providers across all the sites. And within the organization, we're constantly messaging one another to discuss patients and what's going on with them. So they really feel that continuity. They don't feel like their providers are siloed. That's really fun to be able to do that. So here's an example. I was thinking about what does community partnership look like for us in behavioral health? And I mean, I have lots of examples for my own clinical work. You know, Cecilia's on the call. Lighthouse is a big part of our partnership in behavioral health. And also I think about here in Florence, just a quick story. When I was not here in our big medical plaza, I used to be over in a little building on Palmetto Street in Florence. And there was this man that I saw one day. He was sitting out there on the sidewalk with his suitcase. And, you know, kind of said hi to him and gave him the opportunity to talk to me if he wanted to. He didn't really say anything. The next day he was still there. So I just went and sat down next to him and we started a conversation, and I found out that he had been dropped off there in Florence by his sister from the beach, and he can't see. So already I'm seeing, oh goodness, there's a lot of stuff that we need for him that we don't do ourselves. So I called House of Hope, and this gentleman didn't meet criteria for the overnight shelter. I'm trying to remember why. I think it's because of he had been using alcohol pretty severely. However, he had detoxed, and the fact that he could not see, my friend Mitch at House of Hope came and picked him up and assessed him and figured out what was going on with him. We'll just call him Jim, our patient Jim. And so I have to throw this in for your Wednesday morning. He knew that he had hidden his belongings behind a Food Lion in a shopping center where there was a Chinese food restaurant. Well, Mitch was happy to report later that day that there are like 5 Food Lions in Florence, and all of them have a Chinese restaurant in their shopping center. So they drove to all of them to try to find Jim's belongings, and they got him. And we worked on getting him a vision appointment with one of our vision providers in the community, just so he could get an exam, so we could figure out why this man could not see. And then HopeHealth, not HopeHealth, House of Hope was able to then work with Mercy Medicine to get the procedure paid for. He needed cataract removal. And so that was one of those times where, wow, you know, we can do what we can for this patient, but we can't do everything that this patient needs. And we also just can't leave him stranded on the sidewalk in the middle of Florence. And that to me, that was a very beautiful story. Another example would be my friend Cookie at Tenacious Grace. She has, I don't know if you know about her Five Sparrows program, but they provide housing for women who are just released from jail. So previously incarcerated women who need to get back on their feet, and their house can hold 5 women, so it's called Five Sparrows. And just yesterday I was communicating with Cookie about our partnership, and I thought I really should mention that today to you all. So, you know, that's an area where we can provide things that Cookie can't. So her staff, you know, brings these patients in, or these residents in, and we make sure they get the medical care that they need. We work with their medical providers on their emotional well-being, and making sure that we're addressing any substance use issues that might be there, supportive counseling, learning skills like assertive communication and healthy decision-making, emotional distress tolerance, so that they don't end up back where they were before. And families are restored in that way. So that's another example of where community partnership is really present in my everyday life here at HopeHealth. That's the kind of partnership that we want to make sure we have in all of our service areas, not just here in Florence. So I think about, you mentioned transportation, food insecurity, any, you know, areas where we can get children and families and adults enrichment activities and things to improve their quality of life, not just meet basic needs. Psychology, we always talk about the hierarchy of needs, and we have to meet security, safety, food, but there's so much beyond that for people to live a quality life. And so that's where I think all of us working together is essential. That's really great. So I surveyed my behavioral health consultants to ask them which agencies or organizations do you connect with the most. And they mentioned, of course, they mentioned Lighthouse and the First Friday events that we have here in Florence. They also mentioned House of Hope. They mentioned PD Coalition, Care House, the Naomi Project, which helps women from abusive relationships and their children get back on their feet, similar to Five Sparrows, and the Commission for the Blind. I've connected with the Literacy Council in the past. You know, there are just so many areas. So again, we want to strengthen all of those connections, create new connections where we don't have them. We here at HopeHealth just want to give you a glimpse. When it comes to families and children and enriching lives, there are a lot of things we're working on. We're trying to expand our services. I mentioned we had 5 or 6 providers when I got here. We're now about 30 behavioral health providers across our system, and that doesn't count psychiatry. It's all of our non-prescribing providers, our social workers, our counselors, psychologists, and we are looking to expand the services. So for example, if you've heard of Triple P Positive Parenting Program, that's one of my favorite parenting programs. And I used to work with Florence Run Schools, going in and teaching parents some of these behavior management techniques. And Triple P is one of those programs that it does all of that, and it has an evidence base to show that it reduces the risk for child abuse and it improves the quality of the parent-child relationship. So we are acquiring funding to be able to train more of our behavioral health consultants in that modality of treatment. So that to me is very exciting. I also am planning that we will one day be able to provide more intensive treatment for patients who struggle with difficulties like borderline personality disorder, where there's a lot of self-harm, a lot of suicidal ideation, a lot of emergency department visits, a lot of crisis calls, a lot of 911. And we know that there are treatments out there like dialectical behavior therapy, if you're into psychology and counseling, that are shown to reduce that distress and help people make better decisions and not cut off their nose and spite their face, but to improve their own quality of life and their functioning, which then ripples out to their children, to their family. And so we're looking at providing more of those types of services too here in Florence. So yeah, I'm trying to think what else you might want to know. Our primary care behavioral health consultants, they see medical patients, but if they are working in an area where somebody who's not a medical patient needs to be seen, they will see them. We want to make sure everybody has access to what they need as much as we can possibly provide that. And we also have a lot of patients, you know, they're definitely our medical patients, but they're also maybe self-referred from the community. So we have a lot of people who come in off the street, well, not off the street, but they come in for substance use services, and they've been denied medical care because they've been kicked out of a medical office before for what was in their urine, for example. So we get them in here, we receive them, we engage with them, and we make sure they get their primary care needs in too. So yeah, I've talked and talked and talked.
Overview. That is a terrific overview. And I love hearing about it from your perspective as to how the clients come to you. I think if you're ready, we could pivot to Cecilia and she can talk about it from her perspective, serving similar clients and taking them to your services.
Yes.
Would that be we're ready to make that? Cecilia, will you please tell us a little bit about Lighthouse Ministries, and then will you tell us how the partnership with HopeHealth started and what you love about it?
Good morning and thank you. I appreciate it. And I just want to say from the beginning that it's interesting to hear these ladies say they're nervous, because if y'all ever met them, they know their stuff. I don't know why they're nervous, but anyway, Lighthouse Ministries. Yeah, I've been with Lighthouse Ministries for about 16 years, and we serve Florence County, serve the community in Florence, and we do basic needs. We help families stay in their homes. We prevent them from homelessness by helping with rent and utilities. And we also have some prevention of child abuse neglect programs, and we have a rent program. So do a lot in our community. And the main thing that I really want to hit on is not living in a silo. That's what some of the things that I heard from them, and being part of the community, a larger part of the community. The one thing that I like most about HopeHealth is that they really do want to be a part of the community and make sure that the families that they serve and the families that we serve get all the services they need. So, and I thank them for that. And I'm also excited to see everybody on here. I know the other counties, Clarendon, Orangeburg, and Williamsburg. It's good to see people serving that community here, and thank you for being here. The partnership that I see with HopeHealth that we have actually, she touched on First Friday Homeless Connect event. I think that's the first time we technically got together and partnered. That was back in 2012 is when it started. That's a community event here in Florence where numerous organizations get together and provide their services one day a month all together. And HopeHealth has been a big part of that and been involved in it. And that's, I think, really where our solid work partnership started. And over the years, it's grown. One of the things that I really see beneficial in partnering with HopeHealth is having a liaison, having that person where if a family comes into Lighthouse Ministries and we see the need, y'all know and I know that everyone really needs a primary physician. We don't want our families having to go to the hospital when they get strep throat, or really even having to go somewhere like doctor's care, because that's not a continuous help. they really need that primary physician to get to know them and know their needs. And that's what I really like about Hope Health, is getting that started. Once they get there, they really just hit on a few things that they do. They really do a lot more than what they're saying. I don't even want to know what all they do. I just get a brochure and make sure I connect them to Hope Health. But starting that primary physician piece is what's most important for our families. So that's something that we make sure that when we're talking with our families, we ask, do you have a primary physician? If not, we kind of make sure that they are a good fit with Hope Health. I would not push anything on a family. I would make sure they're a good fit, and then make sure that we can connect them and having that liaison with Hope Health. If we have an emergency and need to get a family in right away, or not sure how to do that, we can speak with that liaison, and they will take care of it. That's one of the biggest things that I see in our partnership. There's everybody asks, well, that partnership all partnerships are give and take. And Hope Health is also, when we're in need, when we have things going on and we need a financial backing, we reach out to them and they're able to support us that way as well, through different things, whether it's events or whether it's direct services. But that's another thing that I've seen as a benefit. But it's not just that, it's making sure that whenever we do that, we're making the community aware of what Hope Health does and what Lighthouse Ministries does and how we both can connect. But the biggest thing is everybody wants our community to be healthy. We want our community to thrive. And Hope Health is able to be a partner with us to make sure that we're doing that. And she mentioned all the other organizations, and we all really do try to work together to make sure that the families that come in our doors get the services that they need, that they're eligible for, that benefits them. And they want to make sure that the families they serve also get everything they need. And that's the advantage I see to it. There's no downside that I could see. And these ladies really are the top of their they know what they're doing. I don't know why they're nervous. I'm the one that needs to be nervous. But anyway.
Cecilia, thank you so very much. And I have to share that when Hope Health came to us and said, we'd like you to help us reach out and connect with nonprofits. And I said, well, let me understand this partnership. And can I tour two of your best partners? And they said Cecilia and then the Naomi Project, Joyce Ford, both of whom are great together. I see members and I knew them. And so I said, do you mind if I call them and talk to them about how the partnership is operated and what they get their perspective on it? And they were like, please do. And the conversations I had with both ladies convinced me that the opportunity we have here is to introduce you to a long-term partner, a partner with whom your organization can work for many years. And so what we have designed is what we hope and believe is a thoughtful, informed process for making a decision for your organization whether this would be a good partnership. We don't want you to enter into it lightly. We want you to be clearly understanding of what's being asked of you and what the opportunities are for your organization. And I do think there are lots of opportunities for the Hope Health partners. I know, as Cecilia said, that her partnership and Hope Health has been there to help her grow the organization and to sponsor things and to deliver services that help her meet her mission. So the next steps, let me talk briefly about that. And I apologize if you can hear noise in the background. Yes, today would be the day that they decided to start working on our yard. So please forgive that. So we've got one more of these calls scheduled. It's for December 17th. And we'll do the same sort of thing, but Joyce from the Naomi Project will be joining us. But we'll go over what's involved. So it's an introductory exploratory call. We'll also share the recording from this one. So if you think it would be helpful to share the recording with others on your team to better understand it, please do so. And then we will invite those that, having listened to the recording, feel like, yes, this is a real opportunity, to one of 2 in-person gatherings. January 12th, we're going to meet in Lake City, and January 19th, we're going to meet in Orangeburg. And we want to do 2 things at those meetings. We want to hear from you and have conversations about what you see as the overall conditions in the communities you serve, that HopeHealth also serves, around those social determinants of health. For example, do you see that transportation is a critical issue, as was mentioned earlier, or broadband and internet access? And make sure that we are identifying the right partners that can help to address those needs for HopeHealth's clients and the community. And then we started to draft the partnership agreement and then say, here it is, sign it. But then we decided, no, let's design the partnership together. So we will use those in-person meetings to sort of share what's worked for Cecilia and Naomi, the Naomi Project, Joyce, and get your thoughts. Is this a 1-year agreement? Is it a 3-year agreement? Do you want a single point of contact? How do you need to see do you want to have a tour of the facility? How do you want to work with them to better understand their services? All the questions you need to answer in order to enter into a long-term partnership with HopeHealth. And then our hope is between those January meetings and in February, we'll have a partnership agreement. And if you determine that it is right for you to enter into that partnership agreement, we will sign an agreement. And for those that decide to enter into the partnership, HopeHealth has said, let's start off by offering the members a benefit. And so they have kindly said that we will provide 1 or 2 scholarships to the Together SC Summit being held March 9th through 12th in Spartanburg for the participating nonprofits. So design the agreement with us, decide if this is the right partnership for you, be selected to partner, come to the summit, have a chance for a learning opportunity for your CEO and staff. HopeHealth staff will be there, a chance to meet and work with them and talk about it. And then in April, HopeHealth has several open houses that are happening at some of their new regional facilities. And we want to use those as a chance to celebrate the kickoff of the partnership, announce it publicly, invite you and your team to tour their facilities and start working together. So we hope that that process provides you easy access along the way to understand and ask your questions and determine if this is a good fit. Tiffany, did I leave anything out in terms of describing what we've got planned and the steps?
No, Madeline, I think that was a beautiful description of what our plans are going to be. I will ask if we can have a couple of minutes to reflect on a couple of things before we open up the Q&A when you're ready.
Please do. And then if you want to put your questions in the chat box or raise your hand, we'll proceed to Q&A. And I hope there'll be lots of them.
Okay.
Stephanie?
I'm going to, I just really quickly, some of the things that came up along the way, I made a couple of notes of things I wanted to make sure to say to y'all. But before I do that, I want to ask Sally and Farah, is there anything that sticks out or last minute things you want to add that came up while we were listening to one another that you want to make sure that we plug?
I know for me, there were a couple of things. Cecilia, I appreciate you mentioning that there are times when we have a patient in front of us and we're doing all that we can, and we know that we need to connect that patient, to a community service, a partner. And you gave some examples of how HopeHealth and Lighthouse Ministries have done that together, and Farah provided some too. When I was preparing, mentally on what to share with you guys, one of the things that just stood out to me that I failed to mention was that we're like the conduit. The patients don't always know what's available in the community. And the examples that were shared today are just a few of what happened every day when we literally are just linking, we're connecting people to their next step. And sometimes Hope Health can't provide the care that we need to provide because housing is a bigger issue for a patient, and that's what they want to get taken care of. And so we need that network, we need that collaboration so that each of the agencies can do what they do best, and get the patient or the client or the customer more ready, to elevate their quality of life or improve their health. I also wanted to mention that our whole goal is to reduce barriers to care and to keep people out of the emergency room that don't need to be there. So linkage to primary care, if there's a relationship with a primary care provider, that's huge. It saves the community money, it saves the patient money, it saves time. That's like one of our major goals, and I failed to mention that. Just come to us if that relationship is already established. There's so many benefits to that, so many benefits. And I also failed to mention that we'll be opening our Hemingway office within the next month, and super excited about that. And out of that office, we'll be providing primary care, substance use disorder treatment, behavioral health services, and we have plans for more that we will be happy to mention as that rolls out. So I turn it over to Tiffany.
Do you have anything you want to add?
I don't think I do. I just,
Good.
yeah,
That's
I think I'm good.
Sometimes as we listen to each other, we're like, oh, we should have said this. And so I wanted to give everyone an opportunity. A couple of things. I had 4 things written down and Sally covered 2, so I'm so glad. But something that's really sticking out to me that I think that we all have a common goal is that we really want to provide dignity to everybody that we serve. And no matter what our specialty is in the human services and social determinants of health, I think the real key there is dignity. And so we love doing that, and would humbly love to come alongside you and help provide the people that you serve any piece of that dignity that we can. As Sally mentioned, the last thing I want to say, well, 2 more things, I'm sorry. When Sally mentioned the emergency department, I instantly remembered something that we have been working on in regards to young adults. And I don't know, this has been very alarming to me. Madeline has heard my soapbox tangent on this. I'm going to try to give you a small snippet of it. But y'all, our young people are sick, and they don't know it, is the scary part. We knew with our Generation Z, our Gen Z and millennials, that they are not accessing primary care in the traditional sense anymore. They just aren't. They do things differently, and that's okay. And we have really tried to embrace that at Hope Health, and we're working on a program so that we can adapt our services, but without losing quality or anything like that. But we want to do what we can to get our young adults into care. We have developed this program and we're working on it now, and it's called Hope Express. And what we're doing is trying to get people, encourage our young adults to get into care before they're sick, so that when they have their cold, when they get their UTI or whatever it might be, they don't end up in the emergency department or the urgent care. They end up with their primary care provider. And so we are working on this program that a lot of it will be technology based, where someone can get online and click on the button of the time they want to be seen. We're really hoping, by the way, another tangent, we're really advocating for telehealth. COVID allowed us the opportunity to really build and provide so many services to our patients through telehealth that we were not able to do as easily prior to COVID. And so a lot of our advocacy efforts for community health centers and across the whole country is to keep telehealth relative and valid in the healthcare field. So if you ever talk to any of your elected officials, that would be you would do us a big solid if you could make that plug for us. But we really need to keep our young adults into care. What we're seeing is the small population that we have been able to get into care, some of the criteria for this program we're starting was you have to have one or less chronic conditions, you need to be a healthy person, this is something that we will keep an eye on things and keep you healthy if you're healthy. So many of these patients are self-identifying as being extremely healthy. They come in for their new patient appointment, and we are finding that they are the exact opposite of healthy. They have all kinds of chronic conditions or on their way to them, and they didn't even know it. Some of the biggest things that we're seeing, I have had lots of conversations with the providers in this program, and what sticks out to them that they're seeing a lot of are lots of anxiety, that won't surprise you, sexual health situations, and so much hypertension, so blood pressure and blood sugar issues. Many times their levels are off the charts and they don't even know it. And so we've got to capture these 20, 25, 30, 35-year-olds now and get these things under control before they become 40, 45, and 50, and they're having strokes and doing damage that's not reversible. So if that speaks to you like it does to me, I would love to continue that conversation. It's just really on my heart right now because I know South Carolina is a very sick state, and I want to do everything I can to help reverse that. So that's just something that was on my heart this morning that I wanted to share with you all. And I think I'm going to leave it there. So Madeline, I think we're ready for Q&A.
Excellent. Thank you all for those additions. And I think you're right about young people, and the young adults think they're invisible and invincible, not invisible. And that's a group that we as nonprofits don't work with as much. So we may need to sort of think outside the box as to how to convince them that that they need a primary care physician. I know I have that problem with my own children. They think they don't need to go get an annual checkup. So let me just run through some questions, and folks, we'll start with the chat box, and then if we'll open the mics if I don't do a good job capturing what you're asking. There's a question: how does one access services through HopeHealth? Is there Cecilia mentioned identifying if a client is a good fit. Are there times when someone might not be a good fit, and what is the process for them becoming a patient? Can they just walk in the door, or do they have to, can you speak a little bit about how that might work, both if the patient just walked up and working with the partners?
Can I elaborate on what I meant by good fit?
Yes, please.
Before you answer that question, because we have Mercy Medicine free medical clinic here in town, as well as HopeHealth. So we give them both those options. That we want to make sure that they have a primary care physician, but we give them both those options and give them the choice as to what is a good fit for them. And
I think it's important to say HopeHealth is not asking that you work only with them. Right. There are other providers, and they are just saying that they really want you to work with them, and they're going to help make it easier for you to work with them. So that's a good point, Cecilia. Thank you. Tiffany?
Do you want to take that one?
Yeah, I'll take, and then
I'm going to let Sally answer that one.
When you fill in the gaps.
Thank you.
So one of the ways that somebody could access our care is just a call and say, this is what I'm looking for. I need a primary care provider. And our goal is to fit that person into an appointment that day or next day at the latest. That's something that Carl is really trying to work our culture, our workflow into, where a patient can get same day, next day at the latest. That's one of our catchphrases that we're trying to really implement, and it just becomes second nature for us. One of the things that we want to make sure that we do is not to set up money or lack of insurance as a barrier to care. So patients who come to us, they will be asked about their financial situation, family situation, insurance. We have a sliding fee scale that we operate within, and that's based on income and family size. what does happen despite having a sliding fee scale is that sometimes a patient still can't pay their bill. You know, they're going through hardship or something has come up that will not prevent us from seeing them. So we don't want money to be a barrier. If somebody, like Farah mentioned earlier, somebody needs a specialty care, you know, specialty services, they can still call and they can say, this is what I need. There are some commitments within that specialty line of service that we do ask the patient to commit to because it allows for continual or continuity of care and yeah, for us to get to the outcomes that we need to.
You know, and one of the things that we're wondering is whether there are several different layers or types of partnerships that HopeHealth might enter into. For example, it might be that for a YMCA or somewhere that's not doing as much of the human service needs, just putting the brochure out and having a connection that gives visibility to HopeHealth and their services might be a good step. But for someone that's working very closely with clients who have these needs, it may be a deeper partnership. Team, there's a question from Yolanda about the case management system. Do you use it? Will you use the software, and will the partners have access to this case management information?
Yeah, we are not a part of that right now. That network, that software that you mentioned. So the angle that I would come out with that question or that topic really is our case management and our care navigation services. And those are more of that second layer of care that we provide to patients to make sure that their needs are met that are not related to a medical provider, a prescriber, or a prescription, but more of those softer things that extend beyond a medical diagnosis. And that care navigator or the case manager follows that patient as long as needed. Sometimes it's a short-term intervention, sometimes it's a more long-term, sometimes it's linking them to community resources or walking with them through a change of life or a transition or grief. And that allows the licensed provider to do what they need to do. And then it's handed off to the care navigator or case manager, just depending on what line of service that patient is associated with. That's how we utilize that role or that support service, but we are not part of that larger network regarding case management and sharing information.
Are you talking about, which network are you talking about? The Unite SC or the?
I don't know.
There was isn't there, maybe that was just in.
That might be something I can answer. I had been contacted by a provider called Unite Us, and I think maybe several other folks on this call has probably heard from them as well. They're relatively new to South Carolina, but they're a referral management system that I believe is free for most nonprofits to use. And I had sent y'all an email at HopeHealth asking if y'all had heard of them.
Chet, you want to weigh in on this? I know you've DM'd me on it.
Sure. There's a care system in North Carolina called Care 360 that is vast and has been in existence now for a couple of years, that essentially is a software that connects nonprofit, human services, et cetera, all together. So it's not necessarily sharing their medical history or anything like that, but when a physician's office or clinic recognizes that there's an additional need for that patient that is outside of their service area, they can go in to the system and essentially refer patients to all of those various organizations that are accepting referrals. People who are participating on it can make referrals or accept referrals or do both. But it's essentially just a platform where all these human service providers can be interconnected so that their network can be as large as possible and they can serve, meet the needs of all their folks. And it is brand new to South Carolina.
And if I may, this is Yolanda. I just wanted to, can you hear
Yolanda,
me?
will you introduce yourself? I should have asked Chet to do the same. Chet's with the South Carolina YMCA. Yolanda, will you introduce yourself?
Yes, I'm Yolanda McCray. I'm the president and CEO of Black River United Way. We serve both Georgetown and Williamsburg counties. And the reason for my question is because, we're looking at a closed loop process where you were talking about ensuring that, if you're helping someone, but you find that they need other services, how do we connect them in the community? And you could do that. Unite Us is something that we as the United Way Association is looking at. But however, we do have Charity Tracker that is here through SC Thrive. That is a software that you're able to, if I'm helping John and I see that John, he needs other assistance, then I am able to put what I've done for him and then also make referrals to another agency within our community. That way you are tracking what's actually happening to John. As a community, we're able to see how our resources are really going for that total care of that person. And then also looking at our 211 data, because 211 is a human services hotline where someone can call in, and ask for, for whatever need that they may have, and then they're referred throughout the network to the various service providers. So just being able to use the data that we have at our fingertips to really help us inform our decisions as we begin to form collaboration in our areas, especially areas that we've not treaded before or that are, really tight to get in. We'll be able to use that data from 211 to, help us to understand what's going on. So just bringing it all together, continuously hooking up those pipes that, sometimes tend to flow in a different way.
Thank you.
And maybe there is an opportunity to incorporate something that, like the Charity Tracker, into the partnership and how we work together. Cecilia, have you been using that in your work at all?
So I'm familiar with Charity Tracker. We actually use a different software. I have been contacted by Unite Us, and I made notes. I might call Yolanda after this and get some information. To me, it just sounded like another SC 211. That's why I didn't even reply, because I can't, it doesn't make sense to me to have 5 different ways to track people. It's just so but that's a conversation for a later date.
Yeah.
As far as the connection between HopeHealth and Lighthouse Ministries, I see where Spencer's on the call, and he asked, that's what we do when we do an intake. Do you have a primary physician? If they say no, that's when we give them the options of HopeHealth and Mercy Medicine Free Clinic and explain to them how those options can benefit them, and recommend that they do reach out to them. If they ask us to help them reach out to them, then we would make that connection for them by either going through the liaison or making sure that they do get an appointment.
So I think there's probably 2 levels. One where you just sort of have a client or a patient that you just need to make the introduction, and then you're not going to be working with them anymore. But there may be some nonprofits that are working with families or patients on a longer term basis and may want to be working more closely in the case management of the services delivery. And so we may want to think through those of you giving longer care and engagement.
If I could speak to that part, because you guys might help us think through this.
Yes.
In our Ryan White network, we had talked about this very thing and the tracking and just how do you keep up with the referrals that are made, the community options, and making sure somebody doesn't fall out of care, and miss that link. And one of the things that rose up in that conversation all the time was confidentiality and a need to know. So, while we're all medical professionals and we protect that patient as best we can and know how to. There were some questions around, what do you do with the information in front of you? And how do you, who has access to all of that throughout the helping network and service providers? That was one of the things that came out at that time with those discussions. It was a very dynamic conversation. So as we explore these things, I would love to just kind of know how agencies approach that. To protect the patient and even our own intentions, so I just wanted to mention that.
Yeah, well, let's reach out to SC Thrive, because with the charity tracker, they may have some opportunities about that. Let me make sure I am getting to the next questions. Spencer says, do you have I can add, okay, Spencer's with First Steps, and he's talking about the questions that they serve young parents. Then it would be very easy for you to say, do you have a primary care provider, and to make a referral form. So that's exactly what we want this partnership to be about, Tiffany, right? That not only would you be able to ask the question, but if the answer was no, you would be, Tiffany, are you trying to say something?
Sorry, I didn't know we were off mute, but we have a cool thing I wanted to tell you about, but I'm not trying to interrupt you. Sorry.
Oh, that's okay. That's okay.
By the way, I moved closer because I'm trying to read the screen. So I didn't mean to show you my nostrils, but
one of the advantages of Zoom, we get to see everyone's noses really well. Yes, Ben, and your glasses. Go on, Tiffany.
Sally also reminded me, now I'm right up on the microphone and I don't need to scream. So I'm sorry. I got really excited. We've got this really cool thing that we have started doing in pediatrics. Because of the young parent thing, we were finding that for parents of newborns, the mother especially, she's going to her follow-up appointments with her OBGYN after she's got the baby, and usually you are released from your OBGYN at about between 8 and 12 week mark after postpartum. And many young women especially, but I would say women in general, tend to use their OBGYN as their everything doctor. And they may not see their OBGYN after they have the baby for quite some time. And so we know there's postpartum depression. There's lots of things that new parents face after having a baby. And so we have our behavioral health consultant in our pediatrics office now has set up, and I don't know the clinical terms, but she has set up an alert so that when we have a mom coming in for that 8-week follow-up with her newborn, we're sending our behaviorist in to also do a check-in with mom to make sure that she is also continuing care for herself in the primary care setting. And again, if she's seeking primary care somewhere else outside of HopeHealth, that's great. We don't want to interfere with any good, healthy primary care relationship. We're so happy to know if somebody's in care with someone, even if it's not us. But if that mom isn't in primary care, we want to make sure that we are taking care of mom, because a healthy mom is a healthy baby. And so that 8-week check-in with our behaviorist is something that we've just started in the last, 6 months or so. And we're really trying to keep an eye on those new parents in that way.
You know what I think might be another opportunity coming out of this partnership, as you're working with your patients and you see a need that they have that may not be being met by the nonprofits in the community, the chance to go to some groups and say, hey, would anyone like to take on a program for first-time moms, and be offering that? So
that's exactly why we're here.
Yeah.
We want to be a good partner in those ways. So whatever we can do to bring to the table for those particularly underserved areas, we're all about that.
So let me just make sure. I think I see a few more questions. So I think what I'm hearing is that First Steps in all 4 counties would be great partners because of the focus on moms and children. So Spencer, I hope you'll share that with your colleagues in the other counties and see if there's a way that we can, and maybe even there's a primary care association to South Carolina First Steps partnership talking through some of this. But Spencer, maybe you in the Florence County First Steps can be a guinea pig helping us figure out what that would look like. So,
I will.
oh, good.
I
good.
will.
Thank
Any-
you, Spencer.
I've spoken to Williamsburg and Clarendon County EDs already. They're in.
Awesome.
They're
Excellent.
in.
And then Orangeburg is in our new exec program, and she was going to be here but had a conflict. So
Okay.
let's that'll be terrific. Okay, I think I see Brianna from United Way Association asking about the 211 services and how we would tie that in. Brianna, do you want to elaborate on your question? Because I think this ties in sort of to that tracking and connect-
Yes, yes, it does. So, Yolanda already mentioned, brought it up, but that was part of my question my main question that I had too, with me being the regional coordinator for the PD, just wanting to see how you all would use or could use South Carolina 211 with the partnership or within the partnership. I know you all have other means of connecting with one another, but just also seeing how could we already use this platform or this system to help even more with what we have going on now in the partnership that's at topic or at hand.
So just to HopeHealth team, do you get many referrals from the 211 system? And do you feel like it's got all your information and they know everything they need to know
I can
about
talk
you
on
are?
that a tiny bit. Brianna, I would love to have some more conversation with you. At one point in the last couple of years, we have had some discussions with United Way regarding SC 211. Nothing has ever solidified there. I can't tell you what's happening with our referrals, but I know we have talked about some partnerships in the past, and nothing has stuck yet. And that could very well be a responsibility on our end. And so I would love to get some more data on our end to see what's happening currently and how we can strengthen that.
Okay,
So-
great. We can definitely arrange that because I know in the past, I put like this before there's actually been a physical person for this region. It has been a little iffy now, but with us having this role here, the whole goal is now to help try to solidify some of those conversations and the partnerships. I will definitely reach out to you.
That's awesome.
Yeah, so we can
And
schedule
again, it could have been on our end. We could be just as responsible in that. So happy to reconnect there.
that. Okay,
So
great.
Brianna, let me make sure I understand. You're with the United Way Association, but you're the PD regional manager for 211?
Yes. So 211 is a service or a department out of the association. And so I work directly with local United Ways within the PD. So I have contact with Yolanda with Black River, forming more contact with Mindy and Sumter and so forth and so on, and Ori and in Florence. So yes.
Excellent. Well, we also want to invite the community foundations, private foundations, United Ways to be part of those January events because we think that they can be a good learning opportunity for us all to be talking about the needs in the region. So let's talk further about that. And Yolanda, if you'll reach out to your regional United Way colleagues and share with them this opportunity. And I think Cameron was going to join us from Florence, but because we'd love to have y'all involved in this.
Great.
So, okay, let me just make sure I'm not missing questions. Barbara, she is asking if her services will be a benefit. We're in such a rural area where 50% or more of our community don't even go to a doctor. Barbara, would you like to unmute and give a little bit more example of what you do? And let's talk this through. Oh, here, wait, I see you wrote further. You said, at my facility, we work on nutritional education. A lot of the times the primary care physician doesn't have time to sit and talk about nutrition with the patient. We want to help change lifestyles and focus on healthy choices. Is that a resource, HopeHealth team, that would be of use to you and your patients?
Yeah, what organization is Barbara with?
I'm actually the CEO of Lydia's Bowels of Mercy, which is the short is Lydia's Nest. But we offer a lot of different services. We mainly focus on youth and seniors. Twice a week, we do life skill classes, which is I have a dietitian that works with me personally, and we do healthy eating tips. And we just feed them like lunch and learn. We also with the seniors, we provide them with food if they don't have that, the food to eat. But we try to focus more on healthy stuff, and we focus more on education, because a lot of people, they just don't know, they don't understand what to eat. And
True.
like I was saying, the physicians a lot of times, they'll let them know that they have a diagnosis of diabetes and hypertension and stuff like that, but they don't have a lot of time to sit down and tell them what they should eat or what they shouldn't be eating. And so that's one of the things that we do, along with, of course, mentorship, and we do after school tutoring, a lot of other stuff.
Barbara, where are you located? I should know this, but I can't remember.
That's my question too.
In Johnsonville, I'm the lower part of Florence County.
Awesome.
Yeah.
Well, and
So we serve Johnsonville, Hemingway, Pamlico, all of these low cities that that nobody really sees. We try to service that area. That's why I wanted to open up the Community Resource Center, which is what I have there. And they come there to get any resources that they may need, whether I may have to refer them to the Lighthouse, I may have to refer them somewhere else. But a lot of our clients, we are so far out, they don't have a ride to get anywhere. That's another issue. So we're trying to work on getting PDR, TA. So at least we can try to help them find some of the resources, and then we try to offer as much resources as we can at the center. So, because half of my clients walk, they are able to walk because I'm right uptown, where they wouldn't be able to go to other places. So
can't wait to talk to you.
Excellent.
Wonderful.
So Barbara and Cecilia, are you doing similar sorts of work? Because it sounds a little bit like it.
I don't think we do. What I do a lot of, like the Lighthouse, I know that they help people with, like, my client referral sheet. If they come in, they fill out their referral sheet and let us know what they need. Or sometimes I get my referrals from Aunt Bertha's site or whatever, they'll refer the clients to me. But if I see that they need maybe help with utility or help finding a shelter, I may send them to Lighthouse Ministry. Now, one thing that if they need clothes or something, we do that. We do furniture, just kind of helping them with their basic needs. We can do that there.
Great.
Yeah.
You're close, but you're as close to the people as you can get. Thank you for that. I think
okay, thank you.
Catherine, let me read your question. If you want to come off mute, Family Connections of SC. Yeah, go on and just ask your question directly. I think that'll be faster than my reading it, if you don't mind. Are you able to? Oops, maybe Catherine. Family Connections of SC provides statewide support to families of children with special healthcare needs, any diagnosis. We provide peer support, assistance accessing healthcare, and training for parents, including triple P stepping stones, specifically for families of children with disabilities. We also have an asthma education program. At a minimum, we'd love to educate your staff about the services we provide. We also ask if the child has the primary care at their initial intake. So, Hope Health team, Catherine with Family Connections and Roger with Children's Cancer Partners. Roger, I've just forgotten the name. Anyway, are two examples of groups that work statewide with a very targeted audience that may be a benefit to some of your clients and vice versa. We hadn't thought about that type of partnership, but maybe there's an opportunity. Catherine, did you come back on? Are you there? Yeah, there you are. Sorry. Do you want to talk a little bit more about what you're thinking?
Well, I don't know exactly what it would look like, but as a, at a minimum, I'd love to just make sure that the staff is aware of us as a resource, because we can help families with applying for Medicaid, emotional support, connect them with someone who's walked in their shoes and can, go through their journey with them and help them through that. We also provide assistance for situations in the school system. We're the state's Parent Training and Information Center, which is federally designated. So we can help with 504 plans, IEPs, all those kinds of things that, we don't know anything about until we have a child who needs those things. And suddenly we got to become an expert real quick. So we have staff that can help with that. We have an asthma management program. Some things we do in person, some things via phone, some Zoom, it really varies. So we would definitely love to, get more involved with you guys and help those families that could benefit from our services.
Tiffany, let's think about how we might partner with some of these statewide networks. Because I think, Roger, you're offering a sort of similar, Roger Sullivan is not with us anymore. Where'd he go? He's gone. But that was a similar sort of group that works statewide, helping children with cancer get the help they need financially, the families get the help they need financially and things like that. So as I said, that's a partnership we hadn't thought about, but it sounds like it might be an opportunity. Good. Okay, I think we're right at 10:25. That's all the questions I see in the chat box. Anyone else have anything?
Madeline, this is Andrew with HopeHealth. I just wanted to jump in real quick. I've been trying to digest all this information. I know this is more specifically to partnerships to benefit and work with HopeHealth and as far as a partnership. But as you mentioned, it may not be a partnership, but a few opportunities that I just wanted to express is I guess we've done some significant work in Williamsburg with different with some community coalitions, with some other healthcare providers and some other basic need kind of services as well. So I just wanted to encourage that conversation. We work very closely with Williamsburg Regional and some other folks as well. But I just wanted to say to HopeHealth, like this conversation is happening with some other providers as well. So if you find yourself wanting to kind of explore that and navigate that to make sure that all patients in Williamsburg County, et cetera, are trying to not fall through the gaps. We've had some different conversations with Mercy Medicine, et cetera, just as y'all have done. But I know that Williamsburg Regional, as they transition with this MUSC and the purchasing of the hospital, and the opening of the hospital, that maybe there are some opportunities there. Also, the Williamsburg County Community Coalition that comprises of DHEC, Clemson, some other residents as well. They are doing some different diabetes management, hypertension management classes and some different things that maybe could be referrals for your patients or clients, et cetera. So once again, just wanted to put that out there that maybe there are some opportunities for that community clinical partnerships in different ways and different views, as long as it would be beneficial in a mutual relationship, obviously. But also there have been some different things around healthy eating and active living that are happening in Williamsburg County too. So I want to make sure that I get some of the Williamsburg folks that I've been talking to connected. And I see Miss Tracy Presley on here as well, and she's with CMD's Pantry. And they've actually launched Food Share, a local, for those of you that are familiar with Food Share, Tracy and her team at CMD's Pantry have launched that. So once again, social determinants of health, chronic care, getting people some of those basic needs and different things that are happening in Williamsburg. And then the other thing I wanted to mention too, just specifically with Orangeburg, you mentioned new mothers, children, all that. I believe Romaine Stevens from our office is on here. She's with Family Solutions, which is a part of our office. And I believe y'all may have a relationship with them already, but I just wanted to shout out to Romaine and the staff in Orangeburg that specifically work on infant mortality and low birth weight babies, et cetera, and do a lot of home visits, et cetera. So once again, I don't want to speak for Romaine and Family Solutions because they are the experts and content experts for our office, but that just kind of made me think of another possible opportunity or potentially a partnership that that could exist. So that's all I've got is a kind of thought and marinated on this.
Thank you very much.
Thank you.
We may sort of rethink those January meetings and how to use those more effectively, and maybe there's an opportunity to do some work on that collaborative approach that
Yeah,
you're
and the
talking
reason I wanted to make sure I brought up Williamsburg is I know everybody does a community health needs assessment. Some people do their own community health improvement plans, but several of the things that y'all are talking about kind of advance these topics too. Because I know that Alan Abernathy and some of the other leadership over at Williamsburg Regional, they're like, we just want to get other providers together and say, hey, what are you offering? What are we offering? What are the gaps? Could we potentially bring those or network together to kind of bring these resources to, say, Williamsburg County? So obviously, I know that that's the hospital and y'all are F2HC, and I know that there's some different things going on there, but just to try to create that network to make sure people don't fall through those cracks. And, and one other thing, I'm just trying to think, spit it out while I have it in my head is, Madeline, you already may be familiar with Neighbor to Neighbor. But we've had some different conversations with Joe Kunkel about social determinants in transportation, et cetera. I believe they mainly service Horry, Williamsburg, and Georgetown, but he's definitely looked at some different ways to grow his kind of model of a volunteer-based transportation system. So just kind of as another thought about social determinants transportation, I know he's connected with Miss Regina and some other folks in the Williamsburg County. So yeah, I'm going to make sure that if it's all right, I'm going to make sure I invite Regina Neesmith-Dimery, who's with DHEC, as well as Paris Mabane with Clemson Extension Services to this, and they might be able to help kind of navigate some of these Williamsburg specific questions. And several of the other partners, Black River United Way, all of you have been significant in some of these conversations. So just want to make connections and see what kind of opportunities and partnerships may exist.
Andrew, you're wonderful. And yes, we love Joe and have been, this may be an opportunity for expansion of his program because transportation is a critical issue to work on. So, Tiffany, did you want to weigh in?
No, I'm just thankful. Andrew, thank you. And I know there are relationships that outside of this room here that happen in a lot of the different areas that I definitely don't want to dismiss or overlook that our colleagues have in those areas, some that we know about and some that we don't, and there are definitely some that fall through the cracks. And so I'm excited. That was excellent information, Andrew, and I really love all the work of your organization.
So we may be able to use those January gatherings to get a sense of some of the needs, who's meeting them and who's not meeting, what needs are not being met, and see if there might be other partners around the state that we could use this partnership as an opportunity to get them to start serving these counties. So that may be a bigger plan, but we have to give it a try. Yolanda, did you want to say something?
Yes, I just wanted to make mention, thank you, Andrew, for bringing up the work that CHIP is doing in Williamsburg County, but to also invite HopeHealth to the Celebrating the Power of Rural Movement, which is going to be on November 18th. It's the big Rural Health Day, and it's going to be at the Williamsburg County Recreation Center. And that's a time where it would be great.
Is this tomorrow, Yolanda?
Yes, it's tomorrow.
Wow.
Where you'll be able to go and, meet these players that Andrew was talking about, because, everyone will be there. Regina, Paris, the county representatives, Black River United Way, et cetera. They will all be in that area on tomorrow.
Thank you. And I feel like I also just want to make sure that I say this, like in all of these counties, I am sure that there are collaborative councils and things happening, and it is not our goal or intention to replace or recreate any wheels. We know that there's some tables that we need to get to. And so thank you for telling us and inviting us to all of these opportunities. We don't intend to recreate anyone's collaborative council or add anything new. We just want to help and enhance what you all have going on already.
Perfect. And I think that's the perfect closing remark, Tiffany. I think, you've captured what your aim is, why we're so excited to work with you on this. So let me just thank everyone for sticking with us for an hour and a half and weighing in. And you'll get a follow-up email, and then you'll get an invitation to those January gatherings. I guess we'll probably send it out in December, I hope.
Mm-hmm.
But please connect with me or Ben or anyone if there's opportunities you see for us to help with HopeHealth and this partnership. And just thank you for your time and being on the ground doing this work and the people you serve. We know the rural parts of our state can use everything we can offer. So thank you and have a great day.
Thank you, everyone.
Thank you.